The acute inflammation is necessary for your defense system, whereas the chronic inflammation is a driving variety of diseases. And that's the main theme we are trying to provide the fundamental basis at the molecular and cellular level, how they are driving the chronic inflammation.
Mm-hmm. So chronic inflammation is like persistent or prolonged inflammation, but acute inflammation is actually beneficial. So when we say inflammation, it's not one thing, it's many different mechanisms that can be at play, and it's spatiotemporally regulated. So we sort of want inflammation to happen when and where it's needed. Like if I bump my knee, or I get an injury, or I get an infection, you want the inflammation to come to take care of the problem and then to go away. And chronic inflammation basically refers to when it leaks out. It's getting into parts of the body it shouldn't be, or it's extending in time beyond what we actually need it to be doing in our bodies. And that's sort of the problem, a problem of modern human health is chronic inflammation.
That's correct. So you exactly kind of alluded correctly, the acute inflammation. So just like, as we are sitting here, and if there is either fire or, some crime, then either firefighters or the police will come and they will solve the problem and they'll leave the place. Same thing, our immune system is designed or evolved, inbuilt in like from day one to take care of till last day on the planet. Whenever there is injury to the organ or infection or metabolic stress, the immune cells will arrive at the site of injury or infection, and they convert these polyunsaturated fatty acids, what we talk about, and then makes a variety of molecules at the molecular level. And those molecules define what time the immune cells are arriving at the site of injury or infection. At the same time, they are indicating or giving the signal, hey, you have did your job, you control the infection, you control the injury, or you control the fire, or you control the crime, now you get out from here. So the get in and the get out signal is dependent. When this get in and the get out signal is balanced, it means the inflammation and the safe clearance of inflammation is balanced. At the molecular level, we call as a resolution of inflammation. When the immune cells arrived, convert these polyunsaturated fatty acid into variety of molecules, including the like lipoxins, or if polyunsaturated fatty acid is omega-3, then it makes the resolvins, protectins, and medicines. Those are the trihydroxy molecules, and those helps to control infection and injury in variety of organs, depending on the magnitude of injury and how the immune fitness of that individual. That's the biggest difference between the acute inflammation and the chronic inflammation. On the chronic inflammation side, when our polyunsaturated fatty acids content is relatively high and resolution molecules are not formed, in that case, definitely the things don't go as indicated at the homeostasis level, but it's delayed the healing or the continuation of infection, and that's how the chronic inflammation driving the variety of disease or the dysfunction of the organ.
Mm-hmm. So it sounds like at a high level, the basic way this works is the first thing to understand maybe is inflammation has to be actively turned on and actively turned off. You said there's get in signals and get out signals, and there's signals on both sides.